Hi, and welcome to episode 13 of How to Beat Nick, which focuses on healthcare philosophy. This is a meaningfully distinct topic from the prior discussion about healthcare and focuses mostly on the kind of philosophical, non consequentialist obligations that doctors have toward their patients. Traditionally, the way we understand doctors' moral obligations is through something called the Hippocratic Oath, and it boils down to a deontological kind of do no harm, also intuitively heal thy patients. It's in bad debate rounds used kind of as an excuse to evade utilitarianism and just like plays into vague moral platitudes that doctors should kind of heal the sick because that's what they're there for. That's kind of their ontological calling. There are, I think, 5 or 6 different mechanisms by which the modern US healthcare system breaks down the will of doctors when it comes to their own moral ethics. So the first is malpractice insurance. Doctors have to undergo malpractice insurance. Malpractice insurance is actually incredibly explicit about what you are and what you aren't allowed to do. One of the very major things you are not allowed to do is endanger other patients in order to help a patient. So I think the best example is in like a plague case. If someone's coming in with Ebola, you're actually just like not allowed to rush him into the middle of the hospital because you are endangering all of your other patients and exposing them up to all of this liability. And while the Hippocratic Oath might say you got to help the patient, your malpractice insurance company says absolutely fucking not. So one, right, there's the idea that your malpractice insurance will shut you down, it'll deny your ability to practice. Two, there's the idea that your hospital, which is probably either run by a private equity company at this point, if I'm being frank, or like heavily in debt and about to be taken over by a private a private equity company, is just going to fire you. Third is the idea that medical insurance will just deny the claim. There is actually like a real distinction between when the Hippocratic Oath was written and today, and it's actually kind of smart. When the Hippocratic Oath was written, physician heal thyself meant just like use resources to heal the patient and like don't worry about payment because somebody will give you a goat. Today, there's actually a very genuine moral quandary as to whether being sick is better or being worse than being in $100,000 of medical debt. That is probably not a decision that a doctor is in an ontologically preferential decision to make because doctors have an incredible amount of bias, right? They've very often gone into educational debt in order to pay for med school, but usually if they're at like a decision-making point in their career, they're a senior doctor, they've usually paid it off. So they have a very unique and actually fairly atypical experience with debt. Notably, their experience with educational debt is wildly different from people's experience with medical debt. Student loan debt is generally seen as a higher tranche of asset because you have the human capital to back it up, especially if it's student loan debt from medical school. Medical debt just makes you a liability top to bottom, right? It actually makes it harder for you to get a job because people are worried that you might still be sick. Makes it harder for you to get a loan because people are worried that your illness might prevent you from paying them back, et cetera, et cetera. So medical debt is far more crippling to you financially than student loan debt is. Thirdly and finally, this is just like an incredibly individualist decision. Some people absolutely would rather die than put themselves and their family in an incredibly precarious financial situation, especially if you have like joint assets, like joint house, joint bank account. You might not want to financially punish your wife and your children in order just to extend your life. And it's actually not an incoherent moral decision to choose to die rather than to condemn your family to poverty. Notably, this cuts against the Hippocratic Oath in a really unique way because the Hippocratic Oath, the intuitions of the Hippocratic Oath are you got to help patients. You got to make them healthy. But remember, the single largest long-term detraction to health in society is poverty. So if you cure their present illness and then make them poor, there's actually like a very real chance that you don't help their lifespan. And in fact, you might lower it depending on the illness they have, right? Obviously, if they're like literally about to die tomorrow, then you extend their life. But you extend their life into a life of suffering, into a life of poverty, into a life of debt. It is unclear that you are in an ontological position or in a preferential moral position to make that judgment for your patient. This is why, in modern systems, the Hippocratic Oath has just been replaced with informed patient consent. So, you know, you talk to the patient, you explain to them the benefits and the harms, and you explain to them the cost, and then they decide whether or not they want the treatment. The cost is obviously dependent on whether or not insurance approves the treatment. So you go and figure out whether or not the insurance company and the middlemen are going to approve the treatment, and then you go tell the patient. Notably, this also applies to potential spillover effects to the hospital, right? Like, if someone is coming in with an incredibly viral condition, you have to ensure you have their informed consent, but you also have to have the informed consent of everyone else in the hospital who might be exposed to that viral condition. And this is particularly relevant to debates about how you treat the coronavirus, etc., right? Like, if you can't secure informed consent from the rest of your patients at the hospital, that is an ethical violation. It's a prior ethical violation, and it's probably the most coherent ethical violation. Because, again, it's a non-consequentialist violation that impacts the rest of your patients and all of your colleagues and all of your nurses in a way that, like, not helping one patient is just less relevant in a non-consequentialist sense. The third and final, I think, like, actual ethical obligation of doctors can just be understood under utilitarianism. This is true in a resource-constrained hospital, right? So in like a rural hospital where doctors actually don't have the money to provide healthcare to everyone, or like after a mass casualty event when they are in triage, utilitarianism is actually what they are taught in medical ethics classes. It's what they're taught in their trainings. It's what's reinforced into them. It's the norm imposed by hospitals and doctors. Just because if you can't fulfill your normative obligations under informed consent, you just kind of do your best and default to utilitarianism. The last thing, while true, it's not a particularly persuasive argument in a debate round, and you should probably avoid making it, because if you're in a point where you're using the word triage to describe the average hospital experience, you've probably lost the round.